Now let's get started. To kick off today's webinar, we have Lipscomb Pitts Insurance, a Higginbotham Company Managing Director, Craig Wright, to introduce today's speaker, Dr. Ray Fabius. Craig, take it away.
Thank you, Andrew, and thank you, everybody, for joining us this morning. We appreciate that. Tyler McLaughlin and I, with Lipscomb Pitts, have been very fortunate to know Dr. Ray, to get to know him through a mutual client. Dr. Ray has just an incredible background as a global physician executive with stints as the global medical leader at General Electric. He's also been the chief medical officer with Thomson Reuters and Truven Health Analytics, and then just too many other endeavors to enumerate in academics and private practice. Dr. Fabius is a globally recognized expert in pandemic preparedness and response, having served as the global medical leader, as I mentioned, with General Electric during a previous coronavirus epidemic, which we all will remember as SARS. Additionally, Dr. Ray is the co-author of the leading textbook in the field of population health and creating cultures of wellness. For many years now, he has served as a consultant for employers both large and small through his company, Health Next. Health Next is the leader in building enterprise cultures of health and well-being. During this pandemic, Dr. Fabius has participated in numerous webinars and virtual town halls similar to ours today, in conjunction with WellCOA, the National Alliance of Healthcare Purchasing Coalitions, and numerous regional business coalitions on health. Today, we ask Dr. Ray to join us to share his thoughts about the COVID-19 pandemic, focusing on the employer perspective and the promise of the new approved vaccines. So without further ado, I give you, from the city of brotherly love in Philadelphia, PA, the Rocky Balboa of global medical leaders, Dr. Ray Fabius.
I've never been introduced better than that. Thank you so much, Craig. As Craig mentioned, I've had a wonderful journey as a physician executive in many areas of healthcare, but I have settled over the better part of the last decade on the wonderful opportunity that employers have to meaningfully impact the health and well-being of their workforces everywhere. As Craig mentioned, in an effort to really partner with employers large and small, I started a company called Health Next, which I encourage all of you who are listening to visit our website. Over the last 10 years, we've developed methodologies to help employers large and small build sustainable enterprise cultures of health and well-being using Six Sigma rigor. More recently, we've also given companies large and small the opportunity to access physician executives like me to answer questions and provide clinical guidance to things like your benefit structure or even your response to COVID. And my team of physician leaders at Health Next includes the former leaders of I'll say the clinical efforts at American Express, Johnson & Johnson, ExxonMobil, and Procter & Gamble, among others. I do want to share with you that we have a good bit to cover, but I'm going to try to get through all of the content that I want to with all of you, and still leave plenty of time for Q&A. So the agenda here is really chock full of content. Craig, Tyler, Andrew, and the folks at Lipscomb Pitts have helped me put together this session, which we hope will not only provide you with a lot of background, but also some guidance moving forward. And so we're going to review the basics. We're going to assess the comprehensive impact that the pandemic has had. We're going to provide some specific employer guidance related to the pandemic. We're going to review key messages that all employers should be delivering to their employees. We're going to focus on vaccine promotion as a very important effort presently that employers should be engaged in. And we're going to end on some very positive notes here as we can see a light at the end of the tunnel. It was very interesting to see that in the third poll question that you were asked before we started this morning, that many of you thought that there would be a return to normal by the fall of 2021, and others thought it might take until the spring of 2022. I think you're both right. We should see a remarkable improvement in the way we engage with others in our communities safely, I think by the fall. But it may take even a whole year before some of the, I'll say even the psychic trauma of the pandemic to resolve. So let's get started. I'm going to move through these early slides rapidly. I know that you know that this virus still appears to have started in Wuhan, China. Interestingly, it wasn't really that long ago, December 2019. The first case in the United States was in January of 2020. So we're a little bit past the 1-year anniversary of the first identified case. We all know that it spreads mostly as a respiratory pathogen. So the biggest issue is with sneezes and coughs. The second biggest issue is with shaking hands and touching people who may have some virus on their hands from covering their mouth with a cough or a sneeze. And much less likely, but still possible, is that you can contract this virus by touching a surface where the live virus is present, and then touching your mouth or your eyes or your nose thereafter. And most of you know that in the early days, we were telling people that the symptoms of this virus were cough, fever, and shortness of breath. And then over time, there was a list of additional symptoms, particularly curious and unusual and specific to this virus, were this loss of taste and loss of smell. And early on, the CDC created some key recommendations. We think that, for example, employers should liberally post these posters that are available for free from the CDC in every bathroom of every work site, perhaps in other places as well. Remarkably, in studies that have been done historically, where they've put video cameras in restrooms of men and women just to study hand washing techniques, 2/3 of men in these studies didn't wash their hands appropriately, and 1/3 of women. So perhaps the greatest silver lining of this pandemic is teaching children and adults how important it is to wash your hands. Also, perhaps as we move forward into flu seasons in the future, we'll be more cautious about hand sanitizing, and perhaps be a little bit more reluctant to shake hands during flu season, to avoid touching your eyes, nose, and mouth. There are very good studies to show that the average person may touch their eyes, nose, or mouth somewhere between 50 to 20 times an hour while at work. So we need to retrain ourselves not to be touching our nose and mouth and eyes, certainly with unwashed hands. And perhaps another silver lining to this pandemic is that people may be more comfortable remaining home when they're sick. Also moving from this idea of covering coughs with your hands to coughing into your elbow. I mean, a number of these things that we've learned may be silver linings that may actually reduce the spread of common viruses such as the flu going forward. While we've been talking about the flu, I think it's really important that all of you make your friends, colleagues, co-workers aware of the fact that what we're dealing with here with COVID-19 is much, much worse than the flu. And the data suggests that it may be 4 to 10 times worse than the flu. So if anybody's telling you, I'm just, I'm treating this like the flu, that would not be appropriate. And among the things that we do know at this point is that over 500,000 Americans have perished as a consequence of this COVID-19 virus. To put it into some perspective, that's about 1 out of every 500 Americans, American adults. There are about 225 million Americans over the age of 18. And so this is a very sizable number relative to that. We also know at this point where COVID-19 fits into other endemic viruses. It's not as deadly as polio or smallpox, which thankfully have been remedied by vaccines. More on that later. It's not as deadly as Ebola. Obviously, it's not as deadly as the common flu. It seems to be more contagious than the common flu, but not as contagious as chickenpox or measles. Early on, you may remember that there was an outbreak on a cruise ship, the Diamond Princess. And because this was a closed environment and it was highly studied, we learned a lot from the Diamond Princess. About 800 of the 3,700 people who were on that ship actually got infected. And of the people who were infected, about half of them didn't have any symptoms, but they were still able to spread it. But the fatality rate, at least on this cruise ship in this pretty close quarters, was over 1%. More recently, experts think that the fatality rate is somewhere between 0.5% and 1%, but that's quite significant for a virus. And we also learned that the coronavirus is not an equal opportunity infector. It infects the elderly more, it infects the poor more, it infects people of color more. It infects people who have health risks and pre-existing conditions more. And these categories also experience more serious consequences, such as hospitalization and death. And it's one of the reasons why the elderly and those with pre-existing conditions are actually getting priority in terms of vaccination at the present time. And we learned pretty early on that if you're overweight, you're at greater risk of actually getting the virus, and you're at greater risk of actually having serious consequences from the virus. If you're hypertensive, meaning you have high blood pressure and it's not under control, that's also predisposes you to a greater likelihood of getting the infection and getting sick, ill, and even perishing from it as well. This study, which I'm showing you, and I understand it's mice type, take my word for it, all the things on the left-hand side are a list of chronic conditions. The dotted red line means average risk, and you can see that all of the lines are to the right of the average, meaning that almost regardless of what chronic condition you have, you're at greater risk of having serious consequences from the coronavirus. So, we have consistently been recommending to people, even from the earliest days of this pandemic, the importance of actually taking particular care of yourself if you have a chronic condition. And as a consequence of knowing that people who are older are at greater risk and people who have pre-existing conditions are at greater risk, a study done by the Kaiser Foundation found that 1 out of every 4 workers is particularly vulnerable to this pandemic. And so one of the key reasons that employers everywhere have been keen on trying to respond to this pandemic and protect the workforce is to, in particular, protect that 1 out of every 4 worker who has a pre-existing condition or who is older and at greater risk. Now, I want to switch gears for a minute and talk about the impact of the coronavirus beyond even the infections that it has caused. We know, for example, that people who have had symptoms of a heart attack have been reluctant to call ambulances to take them to the hospital because they've been worried that they might get COVID-19. And as a consequence, more people are actually dying at home from heart attacks than have in the past. So we are working hard to make it clear to people that it is safe now to return to health care, and the likelihood of catching the COVID infection is much less than the risk of not attending to the signs and symptoms of a heart attack or stroke in a timely fashion. I do want to also speak to the disruption in chronic care management. I already mentioned that people who have a chronic condition are at greater risk of getting COVID, especially if they're not managing their chronic condition. At the same time, there are studies to show that perhaps as many as 1 out of every 2 people with a chronic condition have been not going to see their doctors or not going to see their specialists to help manage that chronic condition. And perhaps even more concerning is the disruption in primary care and prevention. We know that during the peak of the surge of the infection, perhaps as many as 90% of primary care practices were closed. And studies have been done to show that perhaps as high as 50%, 1 out of every 2 children are behind on their immunizations as a consequence of the disruption of primary care. In addition, there was a marked drop-off in preventative screenings. In particular, I want to call your attention to mammography and colonoscopy screening, which saw a 90% drop in screenings during this pandemic. There's been such a drop in screenings that the cancer specialists in this country are warning us that next year there's going to be more cancer cases picked up at later stages rather than early stages because of this marked reduction in screening. And lastly, I want to talk about the disruption of mental health. We know that as a consequence of the COVID pandemic, about a half of the American workforce are reporting financial stress. We know that a third of the American population are reporting increased stress and anxiety. Of course, we continue to worry about the burnout of essential workforces that have been working hard to keep the economy going and keeping the grid going. And of course, in addition to the strain of more stress and anxiety, we also have our friends and coworkers and colleagues who are actually being treated for mental conditions, and disruption in their ongoing care and disruption in their medication regimes can have very serious consequences if you're being treated already for things like anxiety and depression. And the research is showing marked increases in the diagnosis and treatment of anxiety, depression, and even post-traumatic stress disorder. Now, let's switch gears and talk about some positive things. One is that there's been a remarkable global response. This slide shares with you what we know that has been going on globally. And while there's already 3 vaccines approved in the United States and many more in across the globe, there were initially 290 vaccine efforts going on. And by the way, one of the best ways to explain to your friends, your colleagues, your coworkers, your employees that the vaccines are safe is that even though there have been 290 vaccines that have been, I'll say at least initially developed, at least in its early stages, only 3 have passed the required testing muster that showed them to be safe and effective. In addition, there's been a lot of effort engaged in to try to find treatments that can work when people have COVID. And so let's talk a little bit about the treatments. I mean, right now we are telling people who have COVID to rest, take things like Tylenol to relieve discomfort, and drink a lot of fluids. In a way, it's not really that different than what we tell people to do with the flu. Of course, if they start to have worsening symptoms, and in particular shortness of breath, they may actually require hospitalization or even intensive care. Most of the treatments that are available that have shown some effectiveness against the virus are really being delivered just to those folks that require hospitalization and intensive care. And those treatments include drugs that can attack the virus, and then also antibodies that can attack the virus. We're going to switch gears now and talk about things that are more pertinent to those of you that are representing employers, which I would say is I'm told the bulk of the audience here. And so there were a number of early employer guidance, and I'll just mention to you that at least a subset of this deck I will provide to Craig and the folks at Lipscomb Pitts so that it can be posted for your further reference, because I'm not going to be able to go through every one of these recommendations that I will list for you, because there's 3 pages of them. But early on, there were some things that we wanted to try to make sure that employers were telling their employees to do, or engaging in their employees in important ways. When I am asked about what is the best early response to a potential pandemic, I always mention from what I learned when I was managing the over 300,000 employees at General Electric worldwide during SARS, and that is to provide as much information as possible to your workforce as you learn things, and then secondarily overreact until you know better, or take a very conservative approach. More recently, this concept of providing as much credible information as you can to your employees has been given the title of information therapy, because there's been evidence that when you give people a better sense of what's going on, it is comforting, especially from a trusted source. So we strongly recommend that you continue to provide frequent communications to your workforce as more information becomes available, including the information that I'll get to toward the end of this that came forward just yesterday of new recommendations for those who have been vaccinated. I also want to mention on this page, this bottom reference, which is something that 10 years worth of research on building sustainable cultures of health and well-being for employers has generated, and that is the importance of a medical home. When CEOs ask me why their healthcare costs are so expensive, I tell them, and we'll talk a little bit more about this in a minute, that one of the reasons is there's a sizable portion of your population that you are covering in terms of insurance who have no medical home. They have no place to go when they get sick. And so they're the ones that are more likely to hit the emergency room and incur significantly more costs and actually receive much less guided care, much less quality care as a consequence. So in particular, during this pandemic, it's especially important for you to communicate to your workforce the importance of having the relationship with a trusted clinician, having a medical home, having a primary care practitioner who you can reference and access when you need some guidance or treatment. I won't spend a lot of time on this because I want to cover a lot of topics, and perhaps Lipscomb and Pitts can have me come back at some point even to talk about what it means to build a culture of health and well-being inside of companies and why it's actually a competitive advantage to do so. But you can see from many studies, including this one, that when people actually are connected to a doctor, they even do better than if they're just connected to a practice. So if someone says to you, yes, I go to this practice, this primary care practice, and then I see any doctor in it, we would be encouraging that person to establish a relationship with one of the primary care doctors or providers in that practice. And that would even be a step up. So first it's affiliating with a practice, then it's affiliating with a doctor in the practice that generates the best of results. I will share with you that during my tenure as the population health strategist with Walgreens, we were putting retail clinics into the pharmacies around the country. And we wanted to make sure that we were able to deliver a report back to the primary care doctors of the patients that we saw in these retail clinics inside of the Walgreens stores, which were called Take Care clinics. And I would like to ask all of you in the audience, what percentage of the people who we saw in these clinics told us they had no place to send the report. They had no primary care doctor to send the report. They had no medical home. We call this group medically homeless. I will share with you that the vast majority of the people that we treated in these clinics were covered by insurance. So they were not the uninsured. They were not people on Medicaid. So think about it. Was it 10%? Was it 20%? Was it 30%? Was it 40%? The answer was 40%. Now, other studies have been done since that time that also show a very sizable portion of the American population are medically homeless. So this is a very important point to drive home, especially during the pandemic. Now, we move to some more recent guidance, employer guidance. Obviously, to the extent possible, many of you have spearheaded efforts to move people from the workplace to working from home. Many of you understand the importance of creating, for especially the essential workforce, much smaller work groups, so that if somebody were to get COVID, they would only expose a couple other people to COVID. So instead of working in groups of 10 or 12, working in groups of 3 or 4 was something that has been done by many and recommended now for a while. Of course, it's really important for you to develop an infectious disease outbreak plan so that you know how to treat people once they're exposed and have some way of screening people to come into the workforce in those operations that continue to remain open and active. And increasingly, it's becoming clear that there's merits in having a chief medical officer or a chief health officer or a clinical advisor. This is something that our research has demonstrated for all the companies that are building cultures of health and well-being, sustainable cultures of health and well-being. And in fact, the Wall Street Journal not too long ago actually had an article recommending accessing or hiring a chief health officer, and had a long list of reasons why it makes sense for an employer to do this, even before speaking about the pandemic. Of course, having access to a physician executive who is experienced in population health can be remarkably helpful during these times. Then I would say the most recent employer guidance really speaks to the need to have some connection with the public health resources in your community so that you can get some local updates, help perhaps with contact tracing, and now more recently provide some access to vaccine guidance. In addition, obviously, you need to have some kind of return to work policy for people who have had COVID-19 and support and monitor the vaccination of all essential workers. And then you have to go through considerations for where it may be appropriate to mandate vaccination, where it may make sense to adjust your benefit plan to eliminate or minimize any financial barriers to vaccination and treatment, and to consider incentives for people who actually go through perhaps educational modules in vaccination. And this is something that we're doing. We're working on many of these things right now at HealthNext with our employer clients, including one that we're working with very closely with our friends at Lipscomb Pitts. I think ultimately, for all the reasons that we've talked about already, it makes great sense to commit to population health and building a sustainable culture of health and well-being, because the more people that you have who are of normal weight, the more people that you have with normal blood pressures, the more people you have without a chronic condition, the more resistant and the more resilient your workforce is against any illness or disease that may come forward in the future. When we talk about the concept of population health, as is referenced in my textbook, called Population Health, with the subtitle of Creating Cultures of Wellness, we're talking about keeping the covered lives or the employees who are well, reducing the health risks of people who have health risks, making sure that everybody has a medical home so they have rapid access to care when they're acutely ill, helping people with chronic diseases manage their chronic illnesses so they can be their best selves, and making sure that people who have a catastrophic situation get the best care healthcare has to offer. As I've already mentioned, until there's a vaccine available, it makes great sense to communicate to your employees that the best defense you have against this pandemic is to take good care of yourself, that vitality is the best defense. So not smoking, staying in touch with loved ones from a mental health standpoint, eating fruits and vegetables every day, getting adequate sleep, aiming for a normal weight, exercising every day. These things are all very important. And every employer across the country should be promoting those things even before this pandemic, but especially during this pandemic. It's also, as I've mentioned already, this disruption in healthcare has been devastating. And so it's very important to convey to your employees that it is safe to access care. The healthcare system has made numerous adjustments, and so the exposure to COVID is highly unlikely if you go to your primary care office. Obviously, you still have the opportunity to do a good bit of care virtually with telemedicine visits as well, but you really want to make sure that you're not delaying preventative services, that you're getting your annual physicals, and that you're taking care of any conditions that you already have. And so we want to try to encourage all of our employees to have a medical home, to use the emergency room appropriately, to build relationships with primary care doctors, to get an annual checkup, and all the other things that we've been promoting around health and wellness for a while in relationship to healthcare delivery. It's equally important, as I've mentioned before, from a mental health standpoint, to have a campaign with all of your employees around managing stress. Obviously, key among them is exercise. We continue to recommend 30 minutes of exercise every day. And it's also very important to relay to your employees that all behaviors are not at equal risk of exposure. So on the one hand, opening up your mail every day is a very low risk. On the other hand, going into a large crowd of people in a small setting like a bar is very risky. And so interestingly, this chart that I have on my left was generated, I'm pretty sure, by the Texas Medical Association. So many of you who are listening to this from Texas should access this chart. And this would be something that would be worth distributing to all of your employees. Obviously, the recommendation until further notice is to continue to wear a mask, to continue to wash your hands, continue to physically distance, to continue to stay home if you're sick, to cover all your coughs and sneezes as we get through to the light at the end of this tunnel. And it's very important to appreciate the fact that many of your employees are tired of this at this point. And so there is this crisis fatigue. And so it's important to encourage all of your employees to remain vigilant and to wait for better treatments and until they can get effective vaccines, which is really not that far off now, as we're now delivering about 2 million vaccines a day in the United States. And with that cadence, we should be able to get everybody immunized perhaps by the end of May. At the same time, in studies that have been done globally, the United States is a country that distinguishes itself by having a large percentage of its population that are not confident in vaccines in general, and as a consequence are not confident about these particular vaccines. And when compared with a number of other countries, you can see that there's a remarkably high percentage of doubters in terms of getting the vaccine. It was wonderful to see in our first poll question today, as I look at my notes here, 55% said that they were going to get the vaccine as soon as it was available, and another 25% were pretty sure that as they felt comfortable getting the vaccine, that they would get it. So among the folks that are listening in today, we have 80% of, based on this poll, 80% of you are likely to get the vaccine, which would infer it's for the community, herd immunity, and protect the whole community. So 80% is a really good goal for us to shoot for as a community, or even as I'll say a workforce. So I'm going to take some time here and now talk about how you can help promote the confidence in vaccines for your employees. First of all, vaccines are a great human achievement. One could argue that it may be the greatest human achievement. As a consequence of vaccines, we no longer worry about smallpox, tetanus, diphtheria, whooping cough or pertussis, measles, mumps, German measles or rubella, and certain kinds of pneumonias, and even hepatitis. Not that long ago, our grandparents, and in some cases even our parents, worried a great deal about the threat of polio, which could cause permanent paralysis, as it did with, as you can see here, Franklin Delano Roosevelt, or even death. And polio was actually much more contagious and deadly than even this COVID virus. So we have a long history of success with the use of vaccines. So it's really important to convey to your employees the importance of this history. So these vaccines that have been approved most recently are not based just on 1 year of research. They're based on 200 years of vaccine science. The first vaccine against smallpox was actually administered in the late 1700s. The reason why these vaccines were able to be generated so quickly was because of a number of unique factors. And I think this is also important to convey to your employees. There was a tremendous amount of money invested, not just by the federal government of the United States, by governments worldwide. We had a remarkable head start on the development of these vaccines because there had been a lot of research done to develop vaccines against SARS. But fortunately, we were able to get rid of that virus through public health efforts without having it become a pandemic. So the vaccines were not necessary at that time. The fact that it is a pandemic made it possible for the companies that were making vaccines to get a lot of people to volunteer quickly to participate in the studies necessary to prove the safety and effectiveness of the vaccines. And the federal government actually changed the way they normally do business and told the companies that were making the vaccines that they would like to see reports as they were generated along the way, rather than waiting for the full report of studies that were done at their conclusion. So at the point where the federal government was reviewing for approving the vaccines that have been approved, they were already well aware of a lot of the data ahead of the final decision making. And then lastly, there's been an unprecedented global collaboration of the scientific community in pursuit of the development of these vaccines. But at no time, and it's very important to convey to your employees, were there any shortcuts taken. All the vaccines had to go through the 3 normal phases to show that they were safe and effective. And perhaps the best way of explaining this to your employees is to tell them that a wonderful vaccine company, Merck, came forward with their vaccine and it didn't work effectively enough. And as a consequence, they stopped making that one, and they have subsequently partnered with Johnson & Johnson to make more of the Johnson & Johnson vaccine. So a very successful, well-funded, powerful pharmaceutical company, Merck, came forward with their version and it didn't pass muster. So there's a very strict process that takes place for approval. It's very important to convey, as a consequence of all of this, that the approved COVID vaccines are remarkably safe and effective. In fact, these vaccines are more safe and effective than many other vaccines that we typically encourage you or your children to receive. And the risk of having a serious consequence from COVID is way, 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 way greater than the risk of any kind of significant consequence from getting these vaccines. I alluded to the fact that we have a chance to see this wonderful light at the end of the tunnel. In order for that to happen, we need somewhere between 70 and 85% of a community or a workforce to get vaccinated before we think it will be universally safe for everyone to embrace a loved one, work alongside a coworker, and dine with friends. But this is possible as a consequence of the miracle that these vaccines offer in terms of promise. I wanted to just take a minute or two. I just created this slide this morning, and please give me a little bit of slack. I'm still working on all of the recommendations that have come in from the CDC in regards to those who've been vaccinated. I do want to share with you that this is an issue that will continue to challenge all of us and the CDC, because on the one hand, we're still studying to what degree these vaccines provide protection. And on the other hand, we're still very interested in trying to minimize spread, particularly of some of the new variants that have come forward. But I thought the CDC this morning came out on balance with very good recommendations. So 2 weeks past the completion of your vaccines, the CDC is now saying you can meet with other people who've been completely vaccinated in a small setting. You can have small meetings with others who are at low risk in an indoor setting, particularly, able now to visit with your family, to visit your children and your grandchildren, for example. Um, and if you are exposed to somebody who has COVID, but you don't have any symptoms, you're not required to isolate, quarantine, or get tested. But they're still recommending, even for people who've been vaccinated, that when they go out, they should actually wear masks. They still need to do good hand washing. They still need to physically distance from others. They still need to avoid large gatherings, and they still need to restrict their travel until further notice. A key message to deliver to employees is that there are many different places where they might be able to get a vaccine, and they should be actively exploring all of them. They should be talking to their medical home, their doctor's offices. They should be talking to their retail pharmacies, their local pharmacies. They should be talking to their local hospitals and local health delivery systems. And they should be accessing contact or websites that are developed by your local public health authorities. And then there's this message for all of us. And the message for all of us is, it's not just this series of things that we're recommending to safeguard us against COVID-19 that are important, but we must take care of ourselves, and we must assist our coworkers, families, and friends every way we can to take care of themselves. And that can create resistance and resilience to this pandemic and illness in general. You know, as you can hear from my messaging, part of my message is that we need to work much more diligently to help all of us become healthier and more well. But one of the ways to get there is to roll your sleeves up and get a vaccine and encourage others to do the same. At this point, I want to turn it back over to you, Craig, for monitoring the next segment of this presentation and answer some questions that have been generated.
All right, thank you so much. We
Oh,
have
Andrew, are you going to do that?
yes.
Okay, thank you.
All right, we have some great questions. The first one comes from Connie. She asked, can someone transmit COVID if they've received the vaccine and surpassed their waiting period? She's heard some contradicting answers to this question.
That is one of the greatest questions that can be asked. I would say that we're still studying this, but every study up to this point has demonstrated that at a minimum, the ability to spread this infection is much reduced by the vaccines. And that reduction in spread may be as much as a 2/3 to 3/4 reduction in the ability to spread. Now, the best way for us to really see this in the real world is to watch as the vaccines get administered. And as most people know, we've already administered somewhere around 60 million vaccines, and about 30 million Americans have had their vaccine series. And so now following those big populations will give us more information. But I would say all of the evidence at this point suggests strongly that the vaccines don't just prevent us from getting sick from COVID, but they also markedly reduce the spread, which is very encouraging.
Now I have a question that I assume can be answered quite quickly. If I receive the COVID-19 vaccine, do I still have to get a flu vaccine?
Excellent question. And the answer to that is yes. The flu virus is very different from the COVID virus. And sadly, when you make antibodies to the flu virus, it doesn't protect you against COVID-19. And when you get the vaccine for COVID-19 virus, it doesn't protect you against the flu.
Okay, Ashley asked, what is your opinion of how to respond to an employee who has been vaccinated but is fearful to return to the workplace, even in a limited capacity? Do you think allowing fully remote work is still at a critical need, even with the vaccine becoming more accessible?
I mean, the intent of this question is really in reference to my earlier points that there's been a good bit of psychic trauma from this pandemic, and it's going to take a while before at least a cohort of our friends and colleagues feel safe to return to normal. And it may be one of the reasons why, Andrew, in the poll that you conducted, so many people were saying we're really not going to return to normal until next spring, because it's that group that that has really been impacted from a stress, and I'll say even a post-traumatic stress disorder component to take time to adjust. I do think we need to be empathetic to our colleagues who still have this concern. And I think we should be making adjustments to give them every opportunity to slowly return and feel comfortable.
Now, talking about that poll, do you mind sharing your opinion on when you think we will return to normal?
Yeah, I think that this group spoke very well in their voting, because about 30% said fall of this year, and about another 30% said not until next spring. And I think in many ways the science is going to support a return to normalcy by the fall, because I think the vast majority of Americans are going to roll their sleeves up. I'm encouraged by some of the more recent polling that I'm seeing, including yours today. I mean, if we can get 80% of Americans immunized, adult Americans immunized, we're going to be in great shape by fall. But that doesn't mean that those people who've been psychically impacted by this will be able to make a rapid adjustment to normal. And so for the group that was saying it may take until the next spring before we can return to normal, they may be considering some of that psychic trauma. Yeah. So I guess my answer to you is scientifically, the fall, mentally, it may take a while long.
Great, thank you. Now we have another question. Do you feel that biometric screening should be held in the workplace if socially distanced and with masks to try and increase participation, or does that still substantially increase chances of workplace spread?
This is another outstanding question, and it gets you into this a balancing act between trying to make sure that your workforce is healthy and well and attending to the conditions that matter in terms of their health, and obviously not spreading the COVID virus among the workforce. I would say the biometric screening groups, just like all the other healthcare providers, have made adjustments to minimize the potential exposure to COVID. And so I think it's probably safe to return to biometric screening in the workforce. But some of my clients have elected to instead offer a couple of different options. So their workforce can perhaps either go to a work site to have their biometric screening, or they could go to their primary care doctor, engage in the biometric screening, or they could go directly to an approved laboratory for their biometric screening. Or I would call to everybody's attention that there are even some home kits. They can't do everything, but they can do several good screenings even in a home kit. So there are a number of options to offer employees, and I would encourage employers to use many, if not all of them.
All right, so what are the guidelines on the timing between the COVID vaccine and other vaccinations?
The feeling, at least as generated by the CDC, is to not, I'll say, pile on vaccines during the period of time that you're getting the COVID vaccine. So they're recommending that there be at least a couple of weeks between any vaccine that you've gotten and getting the COVID vaccine series. And then they're also recommending to at least allow for a couple of weeks after you've completed the vaccine series before getting another vaccine. I will share with you, though, that over the 200 years of vaccine science, as many of you know who are parents, we've become more cognizant of the fact that you can give multiple vaccines at the same time. It's just that we haven't done that research yet with the COVID-19 vaccines. And so we're asking that you give some spacing between other vaccines in the COVID vaccine series. And when I say this COVID vaccine series, I recognize that, those of you fortunate enough to get the Johnson & Johnson vaccine will only need to get one. But it's maybe having a 2-week period before you get the COVID vaccine and a 2-week period after you've completed your vaccines, your COVID vaccines, before you resume getting other vaccines would be prudent.
Now, speaking of the Johnson & Johnson vaccine, what do you think about the difference between the Johnson & Johnson vaccine and the Moderna Pfizer vaccines? Kristen has heard that the Johnson & Johnson vaccine is safer because it doesn't affect your RNA.
None of the vaccines actually affect your RNA. The Pfizer and Moderna vaccine do actually provide a little message of RNA that will say tricks your immune system into making antibodies, but it doesn't do anything to affect your own RNA. And all three of the vaccines are remarkably safe and effective. And so my recommendation is to get whichever one you can get access to.
Now, this is a personal question, but it's also one that just was submitted through the Q&A. If we've already had COVID and we have antibodies, should we get the vaccine?
Yeah, the studies are actually showing now that the level of protection that you get is higher with these vaccines than actually getting a case of COVID, which is, again, it's extraordinary because that's normally not the case with viruses and vaccines. So because of this data, the CDC is recommending that even though you may have had the infection, you should move forward and get vaccinated. And I'll tell you again, in my own personal case, Andrew, I believe that I had COVID early on and last March, where I had an unrelenting cough for 10 days and a fever and chills for a couple of days. And I self-quarantined, even in my own home, even away from my other family members. But at the earliest opportunity, I did actually move forward, and I've now actually just recently completed my vaccine series.
Now, this is actually something we discussed on our run through a few days ago. But Donna asked, should women wait a certain amount of time to get their mammogram after getting the vaccine? She heard that lymph nodes in the vaccine arm can become inflamed after the vaccine, causing concern on the screening.
What a sharp question. This is actually new data that's coming forward. And I guess all women should know that at least a subset of women will have some inflammation of lymph nodes, particularly on the side, on the breast, that is contiguous to the arm that the vaccine was given. So if you have your vaccine delivered in your right arm, there may be some inflammation of lymph nodes in the right breast. The American Society of Breast Imaging is recommending that women wait a month after completing their vaccine series to get a mammogram. I personally believe that if you make it very clear to the radiologists who are reading the mammograms that you've recently had a vaccine, they should be able to read through this mild inflammation of the lymph nodes in one breast and consider that not abnormal, but just a reaction to the vaccine, and still be able to tell women that their mammograms are fine. But this is something that probably makes sense for women to speak to their doctors about, either their OBGYN doctors or their primary care doctors. What bothers me the most is not that it gets put off for a month. That doesn't, in the scheme of things, it wouldn't matter. But what bothers me is that we're already behind with women getting their mammograms, and I don't want women to put it off very much longer.
Now, speaking of women's health, and I guess this could go with men's health as well, but Lisa asked, she heard a lot of back and forth regarding fertility in the vaccine. Have you heard anything regarding that?
Yes, there were some theoretical concerns early on. None of it has been shown to be true. What we do know is that both men and women who do get COVID have their fertility impacted. In the case of men, there is a reduction in sperm count, significant reduction in sperm count. Now, we do think that that comes back after the COVID illness is over, but if you're concerned about fertility, I think the evidence suggests that you should get the vaccine to protect your fertility.
Wow, that's fascinating. I'm glad Lisa asked that question. Is there any research on the length of effectiveness for the vaccine? Is it something that will need to be repeated, just like the flu vaccine?
It's a spectacular question also. Let's just say that 200 years of vaccine science has suggested that in some cases a booster does make sense. And then let's also say that as we are tracking the variants that are coming about from the original COVID version to some changes that have happened, mutations that have happened, creating some new versions of the COVID-19 virus, it may be necessary to for us to get a booster, especially against some of these variants. So there's more to follow in regards to answering that question. But at the present time, there's no recommendation for a booster. Of course, we're really all focused on everybody getting the first vaccine.
Sort of a throwaway question, but something that anonymous attendee asked was, do you think we'll ever return to greeting friends, strangers with handshakes? If so, do you think this would be wise?
So I am for those people who know me, know that I'm a handshake kind of guy. I'm a hugger, and I hope that we're all going to feel comfortable enough to return to do that. At the same time, of course, it doesn't make sense to shake hands if you're not feeling well. It doesn't make sense to shake hands if you're not doing a good job of washing your hands or using hand sanitizers. And perhaps, as other people have done, as in changing the custom of handshaking, maybe it's bumping elbows instead of hands, as perhaps the new way of greeting people, but doing it in a way that markedly reduces spread. We'll see how it all shakes out. But healthy people engaging in handshakes with other healthy people and hugs, I would hope would return.
I agree. I'm a hugger too. It's been hard this past year.
Yeah, it's been very hard.
Dr. Ray, thank you so much. There's been so many great questions, and I want to thank the audience too, because there has been so many great questions, like I just said, and a lot of them that really help guide just the perception, but also the information, because we do hear so many different things through friends and online information. Now, where can people go to learn more about Health Next or any of your other upcoming speaking engagements?
I think an easy place to refer you to is our website, www.healthnext.com, and feel free to contact me. Here's my easy to remember email address, ray.fabius@healthnext.com. Happy to hear from you. we're spearheading a much grander movement than just response to the pandemic. There's been a good bit of research, much of which I have published, showing that companies that actually take care of their workforce in a much more extraordinary and comprehensive way actually outperform in the marketplace. And so while many leaders of companies talk about their workforce as being their greatest asset, only a few are really committed to creating sustainable cultures of health and well-being. And by that, I mean demonstrating evidence that over time, their healthcare costs stabilize and even reduce. And there's evidence that their workforce is getting healthier over time. So I encourage everyone who's listening to this to join this health and well-being movement because it is not only the right thing to do, but it's better business.
Dr. Fabius, thank you for joining us today, and thank you for having this conversation. For those who'd like to learn more about employee and employer guidance, Lipscomb Pitts Insurance has a great COVID-19 resource center at lpinsurance.com. We will be sending this presentation out to you later this afternoon. We appreciate everyone joining us, asking questions, and having an engaging conversation. Dr. Fabius, thank you again. We appreciate it, and we hope to hear from you soon.
Yeah, thank you, Lipscomb Pitts, for sponsoring this and giving me the opportunity to share my thoughts with the audience. And Andrew, thank you so much for being such an excellent moderator. You made me look good.
Thank you. It's a team effort.